Hello everyone, this is Dr. Manpreet Khurana, and today we are going to learn the classification of cephalosporins. This classification is very confusing. All the drugs are similar with similar names, similar looking, and sometimes we get confused which one is first, which one is second, which one is third, and which one is fourth generation. So there are actually 4 generations of cephalosporins. So let's understand how to memorize them and how not to get confused. Okay, so to start with, the first generation, as we know, the first alphabet A, the first generation are mostly A, like cefazolin, cefalexin, cefadroxil. So all A are first generation. In the second generation, we have one A copied from the first, which is cefaclor. Rest, the drugs are furo and O. Okay, furo and O. We'll again learn it, but let's first understand the tip and trick. Okay. Second is furo and O. The third generation are ceft, cevd, and OO. Now, if you see the CEFT and CEFD is only there in third generation. It's not there in first, second, or fourth generation. So if any of the question comes in the exam, in a multiple choice question, if there is CEFT or CEFD, it's always third generation. Like ceftriaxone, ceftriaxone, ceftazidime, then ceftibutyn, ceftamadepivoxil, cefdinir, right? So all are ceft and cevd. Then because we copied one CEPA or one A from first to second generation, we are copying 2 O's from the second to third generation, right? Because there is one O in the second generation, which is cefoxetine. Here, if you see, this is cefoxetine. In the third generation, we have cefotaxime and cefoperazone, right? So there are 2 O's, right? The fourth generation is pime or pyrome. These pime and pyrome are nowhere else, right? So we can say cefipime and cefpyrome are fourth generation cephalosporins. Okay. So in a nutshell, the first generation, remember A. Second generation, remember furo O and 1A. Third generation, ceft, cevd, double O, ceft, cevd, double O. And in the fourth generation, pime or pyrome. So even if you remember the basics, you can take the odd one out of the options, because if there is a question based on the generation of cephalosporins, you will never go wrong. Thank you and have a nice day. Bye.